talked about suicidal behavior and other indications for treatment for psychologists or psychiatrists. Any symptoms, as we've talked about, that are severe and that are chronic, that have not been adequately well managed, either by what you can do or what your primary bladder cancer treatment team has been able to help you do, or for benefit you receive from BCAN. So if you're having significant symptoms that are not adequately well managed, referral to a psychologist and or psychiatrist may be an important part of helping you fully recover and regain your optimal quality of life and life activities. We've talked about overuse or abuse of psychoactive substances as a reason for referral for a mental health care professional. Symptoms of acute or chronic traumatic distress, for instance, patients who have anxiety, that may be mild and somewhat distressing, or it can be disabling. And I've seen patients who required very sophisticated interventions so they could actually undergo procedures, but were able to do it and do it effectively with such interventions. And anytime you have significant dysfunction in other life areas, it's also personally significant or significant, like family relationship problems, or in these other areas of life. If it's severe and it's not well managed and it's impairing your life, referral to a psychologist and or psychiatrist can often be both helpful and needed. Let me just make a point, because I've spent much of my life working with cancer patients in the hospital cancer center setting. I fully understand many patients come to the idea of seeing a psychologist or psychiatrist with a certain amount of trepidation or fear or anxiety or distress. And I would hope that if you're having a level of distress where seeing a psychologist and a psychiatrist would be very helpful to your care, that you would understand that these individuals' purpose is to help you and not in any way to undermine your self-confidence and that it's not a reflection on yourself if the services of these individuals are important for helping you fully recover. So what do psychologists and psychiatrists do? There are specific intervention techniques called cognitive behavioral therapy interventions, typically developed and administered by psychologists, that basically say we live in the world of emotions, we live in the world of thoughts, and we live in the world of behavior. And that if patients, for instance, are having significant anxiety or depression, that often structured interventions that also focus on their thoughts and thought patterns related to their symptoms, and also help them come up with new approaches to more effective coping behaviors, that they can also diminish their level of anxiety or depression, as an example. So these are important structured interventions that exist and can be very helpful for treatment of patients who are having significant anxiety and or depression. We've talked about the importance of learning and utilizing stress management techniques that you can do really on your own. Individual counseling or support groups are very important. BCAN offers them. There can be many other sources potentially of both individual counseling by social workers or marriage and family therapists and so forth, and support groups, which can be peer-led or ideally professionally led, in my view. Some individuals and families benefit from couple or family supportive counseling at various points throughout the illness, as these may be associated with significant family distress. And then psychotropic medications exist, which can be used as appropriate for problems with sleep, anxiety, depression, or fatigue that haven't responded adequately to other interventions. I'm going to talk a little bit about psychotropic medications and simply making the point that they exist. They're never the whole solution to the problems that bladder cancer patients experience, but they often can be an important part, especially when combined with counseling or therapy of some cause of helping manage the symptoms. So these are the general names we use for medications for anxiety and depression and insomnia. I do want to mention that there are medications for severe cancer fatigue, so-called CNS stimulant medications, common ones being Ritalin or Adderall. It isn't common that fatigue is that severe, but I've had over the years many patients who had severe fatigue that didn't respond to any other intervention, who got profoundly positive life changes from taking these medications. Again, all these medications need to be used very judiciously and carefully and thoughtfully, and the results followed very carefully, and side effects. So it's not, any of these medication decisions shouldn't be taken lightly, but I just want you to know that even severe fatigue can respond under certain circumstances dramatically to appropriate medications. Cancer nerve pain is a not uncommon problem, and there are medications that specifically can be helpful for treatment of nerve pain related to cancer and its treatment. Specific anxiety medications, again, I'm not going to talk about them other than to say that there are specific medications that have specific mechanisms of action, that all of which may be potentially prescribed by your primary oncologist team or by a mental health care psychiatrist. And just these are just some of the names. Just to know, there are a lot of names. They all have their benefits and side effects and risks, toxicities, but in general, when used wisely, they can be an important part of managing both the anxiety and depression. Also, there are a number of classes of medications that can be used to treat significant depression that requires medication treatment. Many of these medications have early side effects, which can be unpleasant for patients, but often these diminish pretty rapidly, often over a few days. But if they're going to work, typically they require 2 to 3 weeks at least before they begin to work. So that's something one needs to know if you're prescribed such medications, or perhaps if you've taken them. And again, I'm not going to talk about them, but there are a variety of specific classes of medications that are used to treat primarily depression. Many of them may also be helpful with anxiety. And I put here the common brand names of these medications that you may or may not have known of, or may or may not have been or might be prescribed in the future. Now, I want to talk, as we approach the end, a bit about, for those patients who have developed advanced disease and are approaching the end of life, these are some of the important principles that we need to ensure are followed for the care of such patients. There needs to be timely, open patient and family communication with the bladder cancer treatment team concerning every aspect of the patient situation. What is the prognosis? What are the treatment plan options? What are the likely benefits, risks, toxicities, and costs of this treatment, including physical costs and not only financial costs? There need to be discussion between the patient and family and the caregiving team about what really are the goals of care at this point in time. What are the patient's priorities and patient and family member priorities? What are the advanced care planning decisions that it's best for the patient and his family to undertake in discussion with, in collaboration with the primary care team? All patients who have advanced disease and who are approaching the end of life should also receive care from a palliative care service or team. And we said that palliative care is important at all stages for managing symptoms and for communication and education, and that's true. But as people do approach the end of life, for those that do, there often are enhanced and complex symptoms that need to be managed. And the teams that have the highest level of expertise that do that in that setting are palliative care services and teams. And for those patients who are nearly approaching the end of life, they should receive early referral for hospice care. And families who experience bereavement should receive both pre and post-bereavement counseling and support. Well, a fairly quick run through maybe not so quick because I haven't been paying attention to time, but a variety of topics that I wanted to raise, and I'm certainly open to any questions or discussions that those on the webinar would like to undertake.